Dr. Hanna Popovych from Ukraine talking on teledermatology during military conflicts. I would request Hanna onto the podium, please.
Hello, my name is Hanna Popovych. I'm from Kyiv, Ukraine. I'm a practicing dermatology and surgery. The topic of my presentation is teledermatology during military conflicts. On February 21st, 2022, the full-scale military invasion of Ukraine had happened that led to the displacement of large numbers of civilian population, mostly women and children, and introduction of martial law in my country. Those who didn't leave spent a long time in bomb shelters without light, warm, without drugs, some medication, and inability to wash too. The result has been an inability to provide regular dermatology services or another medical services, and teledermatology become the primary method for consulting when the war began. During the war, the main problems of telemedicine were the following: damaged infrastructure, inability internet connection, limited resource, scarce equipment and medication in war-torn areas, limited access to necessary technology, and follow-up and community of care. According to the statistic of dermatological disease during the First World War or Vietnam War, infection disease and aggravation of chronic disease prevaled, such as impetigo, scabies, pediculosis, psoriasis, seborrhea, and other. And during 10 months, March 2022 to December 2022, 320 patients were consulted until used two most recognized type in teledermatology: store and forwarding and live interactive. According to the study, majority of diagnoses made using teledermatology were confirmed after an in-person examination, and the correct diagnosis was hampered by factors such as poor image quality and periodic lack of internet connection. We use tools of dermatology such as digital cameras and smartphone, dermatoscope, and internet connective. Another tools we haven't, but nowadays we working to expand our capability and use all the tools of teledermatology. Here are our statistics on the prevalence of dermatological disease during the war in Ukraine. 77% of all disease were infection disease and aggravation of chronic disease, like us another war in the world. And finally, ways to improve teledermatology during the war. There are enhanced data security, implement, for example, protect potential information during transmission, use some protocols, mobile technology solution, use smartphones with hide resulting cameras, for example, telemedicine training and support, provide training and support to healthcare professionals in conflict zone, collaboration networks and partnership, foster partnership between local providers, humanitarian organizations and dermatology association, portable dermatology diagnostic tools, adapting telemedicine regulation and collaboration with local communities. Thank you so much.